Do you know what is the fastest way to shrink an enlarged prostate? Is it A, drugs such as Flomax, Avodart, or Hytrin, or Proscar? Or B, surgery such as TURP, laser surgery, or worse, complete prostate removal? Or is it C, natural remedies such as saw palmetto, lycopene, green tea, or zinc? The correct answer is none of the above. And if you answered otherwise, then your doctor has been keeping something from you. Because you see, as recently proven by top prostate researchers from the Department of Urology, University of California, San Francisco, and confirmed by multiple independent studies done by experts from the Department of Epidemiology and Biostatistics at George Washington University, and by over a dozen scientists working at the Division of Urology, Queen Elizabeth Hospital, Hong Kong. If you're over 40, the one true cause of all your prostate problems and even type 2 diabetes or inexplicable weight gain and hair loss is, in fact, a dangerous buildup of a powerful growth substance produced by your body, which feeds the prostate tissue, causing it to grow 24/7 even as we speak. Left untreated, scientists warn that this could lead to an unexpected and total shutdown of your urethra, which will make passing urine completely impossible. What's even worse is that the prostate tissue will continue to grow and spread uncontrollably to your manhood, testicles, and even your anus. That's why wasting thousands of dollars on side effects-filled prostate drugs, painful surgeries that cost an arm and a leg, or ineffective Amazon saw palmetto supplements or silly at-home treatments will never, ever address the root cause of your prostate issues or constant peeing problems. Fortunately, you can prevent all of this from happening to you too, thanks to a recent scientific breakthrough which will give you control, starting today, control over your bladder, over your prostate, over your manhood, and over your entire life and health in a way that you never thought possible. This powerful prostate health solution is so new and so unconventional, I can almost guarantee that neither you nor your doctor will have ever heard about it before. Even so, it's already been used successfully and discreetly by 74,783 people and counting, including professional athletes, international business leaders, and Hollywood celebrities, people you know by name. And it is scientifically proven to work, whether you're young or old, suffering from occasional urination problems, or even if you've been dealing with an enlarged prostate for months, years, or even decades. And the best part is, it's fast, 100% natural, and completely safe. And every day, thousands of people all across the world who were once like you can fully vouch this really works. People like Jeremy C. of Seattle, Washington, who says,
"Can't believe my doctor never told me about this. You know, he always insisted pills or surgery are the only options I have. But when I finally found out about this from a friend, I realized he was straight up lying to me. Basically, this brought me back to where I was 30 or 35 years ago. It's like now I have a totally new prostate. I used to joke with my friends and say, finally, I now sleep like a baby, pee like a teenager, and have sex like a man."
Or Michael B. from Syracuse, New York.
Searching for something like this literally for decades, but this is truly a game changer. Not that fake stuff sold all over Amazon, which frankly for me never worked. Now I sleep all night without going to the bathroom, which until a month ago I thought would be impossible. My urologist confirms that I now have a perfectly normal prostate and I no longer need to take any drugs. Funny thing is that after I told my doctor about this, he started using it too. How about that? If you want your life back, I cannot recommend this highly enough.
Even scientists are thrilled by this. Here's what Professor Daniel Freeman, men's health researcher and prostate expert, has to say.
After carefully reviewing the scientific evidence presented, I must say that I have never seen such a revolutionary approach when it comes to dealing with prostate problems. Indeed, in my opinion, every man should take advantage of this if they are serious about their prostate and reproductive system health.
And today, I am going to present you all the scientific evidence and answer the most burning questions any man suffering from prostate problems might have. What is the fastest way that I can shrink my enlarged prostate? What should I immediately ask my urologist if I want to avoid a $30,000 prostate surgery? How can I quickly and easily increase my urine flow? What is the ugly truth behind today's most popular prostate drugs, and how can I finally stop using them? And last but not least, how can prostate problems make me impotent and affect my sex life, and how can I stop this? But that's not all. I know that passing urine is now a nightmare for you. That's why, in the next few minutes, I want to share a simple solution that you can try right away to fully empty your bladder in minutes. And let me stress this out. This highly effective tip doesn't involve taking a single pill, and it's 100% safe. Yes, it's that powerful, and I guarantee that no doctor will ever tell you about it. Even more, the powerful long-term prostate solution you're about to discover will keep you healthy for years to come and could even add years to your life. And I promise you this, you're going to feel the difference right away, and you'll wish you'd used this simple and natural solution years ago. And just imagine the difference this could make. No more waiting minutes on end to start urinating, no more weak flow or dribbling after the urination. That horrible feeling that the bladder is not completely empty will be finally gone. No more having the urge to urinate again soon after finishing. No more feeling pain during the urination of waking up 5, 6, or 7 times at night to urinate. How does that sound? But I have to warn you, if you have suffered from prostate problems for more than 3 months, if you don't want to schedule your day around a bathroom and always be afraid that you'll embarrass yourself in public, if you're tired of always waking up at night every other hour feeling that you need to go, if you're sick of being hooked on useless drugs or dread the prospect of prostate surgery, you need to take this action right now. You see, the harsh truth is that every single day you don't take the right steps to treat your prostate puts you in grave danger. And as a prostate expert researcher for more than 20 years, I can guarantee you that the longer you wait to deal with those problems, the worse they'll get. I'm talking about the inability to pee for days, complete loss of sexual pleasure, erectile dysfunction problems, and even deadly tumors spreading to your other organs. Now, if you're a little skeptical about all of this, I completely understand. But I'm willing to put on the line my own academic reputation and money that starting today, you will pass urine normally, sleep like a baby, and finally change your life for the better. But before we get to that, let me first introduce myself and explain why I decided to share this life-saving information with you. Hello, my name is Benjamin Harrison, and I'm an expert researcher on prostate problems. For the last 20 years, I have specialized in the treatment of the most difficult cases of prostate, urethra, and manhood issues. I've had access to the latest cutting-edge research from prestigious institutes such as the Prostate Institute of America, the Swiss Society of Urology, and the Harvard School of Public Health. I've helped treat celebrities, people you know by name, but also thousands of normal people. And together with my team, for the last 5 years, we've conducted the most extensive, large-scale research on virtually everything that impacts the well-being of the prostate. Top causes, treatments, drugs, experimental procedures, natural solutions, and even lifestyle choices. And today, I want to share with you all my important discoveries based on sound, scientific, and thorough research. What are the dangers of ignoring your prostate problems? What works and what doesn't when it comes to treating your prostate? And most importantly, what should you do starting today if you want to put an end to all your problems and live a normal life again like you should? But first of all, let's have a basis of discussion and see how the prostate works. Here's an animation of the bladder full of urine and the prostate, and how the normal urination occurs and flows through the urethra. As you can see, when there's an enlargement of the prostate, called hyperplasia, it will squeeze the urethra, making urination difficult. So let's start with the basics. A lot of men ask, what's going on with my prostate? Is my prostate really swollen? How big should my prostate be? How can I stop it from growing any larger? Here are the hard facts. The prostate gland tends to grow as men age. In younger men, on average, the prostate is about the size of a walnut. Then around the mid-20s, there's a small portion of the prostate called the transition zone, which suddenly begins to grow. It's located in the urethra, the outside of the bladder, to the outside world where it can block the flow of urination. And I'll reveal later on why the transition zone is extremely important if you want to regain back a strong, forceful, uninterrupted, and complete stream. This is vital information. And then, as men age around 40, the prostate grows to roughly the size of a ping pong ball, weighing 30 to 35 grams. Unfortunately, if left untreated, in many men, it continues to grow even further. More and more these days, I've seen hundreds of such cases. Emergency rooms are filled with men who choose to ignore the problem and say, hey, I'm fine, I'll figure it out somehow. But in these cases, the prostate enlarges massively, eventually weighing more than 500 grams. That's as huge as a baked sweet potato. This is called giant prostatic hyperplasia, GPH, and trust me, if you don't take action as soon as possible, this could very likely happen even to you. Now, of course, there are ultrasound tests, MRIs, and rectal exams to determine the size of your prostate, but here's a simple test you can do right now to gauge the size and urgency of your prostate problems. All you have to do is to count how many times you go to the bathroom during a 24-hour cycle. If you need to go more than 6 or 7 times, this means that your prostate size is in the danger zone, and you should act now and not wait until it's too late to do something. You see, prostate enlargement can happen quickly, and often without warning. You cannot be certain how fast it will grow and choke your urethra completely. But the process is already underway. However, I want you to know that you still have time and you still have plenty of hope, because help is on the way. So what happens when the prostate enlarges and the urine channel gets tight? What do men experience? What's the problem with that? Well, usually the first thing that happens is men start to notice that they're having urinary problems or urinary symptoms, such as slow urine stream. Feel like the need to strain to create pressure and force pee out. The bladder can't empty completely. Frequent urination, even during the night. And the need and urgency to go soon after, even though despite the fact there may be little pee volume in the bladder. These are issues that you're well familiar with, unfortunately. But I must warn you, if you leave these untreated, they can lead to acute urinary retention, when a person cannot urinate at all. In this case, the only solution is to cut open the bladder and drain the urine. And if this retention of urine in the bladder is chronic, meaning you've been having this problem for a while, then as the volumes increase, the urine starts to get back in the urethra and into the kidneys, causing kidney failure, which is a very serious potential cause of death. Now, as I promised, let me share with you a simple solution to help you completely empty your bladder in less than 60 seconds. Next time you feel the intense urge to pee, but the stream is so weak that only a few droplets manage to get out, just try this. In a standing position, just flex your knees at the urinal or toilet. That's it! By following this one simple trick, you'll be able to quickly and painlessly boost your stream by more than 70% and avoid the urine entering your kidneys. But there's something else you should know. Having a hard time emptying your bladder is actually the last thing you should worry about. Why? Because having prostate problems and ignoring them or failing to resolve them will lead to something even much worse. According to an early study by researchers at the National Institutes of Health, prostate tissue can grow so much it can affect other organs. As the study shows, The prostate cells become shapeshifters and spread to nearby organs such as your bladder, your anus, possibly blocking it, and even your testicles, which can become swollen and powerful to touch, and from there to your penis, causing sudden erectile dysfunction, major ejaculation problems, and even the complete inability to have sexual intercourse anymore. From the groin area, the shapeshifter prostate cells will travel via your bloodstream to your bones, possibly causing irreversible back pain and joint pain. This is a particular concern, especially for people over 45 with overweight problems, high blood sugar levels, or high blood pressure. That's why if you're a pre-diabetic or suffer from type 2 diabetes, the information you're about to hear today is absolutely critical if you want to completely avoid and treat your prostate problems. So, I believe by now you fully understand the magnitude of the problem. As I've just proven, having prostate problems is not just about the inability to empty your bladder and pee like you should. It's about stopping the growth of the prostate tissue throughout your body. It's about protecting your bladder, your kidneys, your manhood, your bones, and joints, and even your heart. Now, let's talk about your options. What can you do about this? How can you effectively treat, stop, and prevent all of this and avoid such nightmare scenarios starting today? I'm almost certain that by now you have already taken some steps toward treating your prostate. But unfortunately, the problem is still there. I want to tell you from the start that this is not your fault. And that's because you've been completely lied to, as I'm about to show you right now. So, let's quickly review the current options on the market and what dangers they pose not only to your prostate, but also to your overall health. First of all, there's medical prostate management. Please notice, management, not treatment. This means managing the problem, not actually eliminating it. And by now, most likely, you've already heard or even used alpha blockers, such as Flomax, Uraxatrol, Cardura, or Rapaflow, just to name a few. These are supposed to make the prostate muscles smooth and help with urination. And then you have the 5 alpha reductase inhibitors, such as Proscar or Advidart. These medications should shrink your prostate by preventing hormonal changes that cause prostate growth. Is this the end of the problem? Of course not. Here's what you must absolutely know. According to our 5 years long research confirmed by numerous independent experts, and after carefully studying the side effects these medications had on thousands of men, there are 3 major problems with these drugs. First of all, the effects of the medication stops the very same moment when you stop taking them. Because, and here is something that many urologists will curse me for having the guts to reveal, alpha blockers do not actually reduce the size of the prostate. Instead, what they do is to relax the muscles around the bladder and prostate, which will temporarily improve the urine flow. So, you start taking these, you notice an increase in your peeing volume, and you say, hey, this stuff works. What actually happens is that your prostate tissue will continue to increase in time until these drugs will not be effective anymore, and $30,000 surgery will be your only option at best. Basically, if you take the conventional road, at first, you'll get hooked on some chemical solution which does not address the root cause of the problem and just masks it. This means that you'll be dependent for all of your life on this. Instead of treating the problem, you just put on Band-Aid. Is this a viable solution? Of course not. The second problem, absolutely horrible side effects. Let's think for a moment. You're putting chemicals in you for years, which are actually targeting the most treasured part of your body as men, the reproductive system. How can something good come out of this? It can't. In fact, if you've experienced drowsiness, nausea, diarrhea, headaches, decreased libido, trouble breathing, chest pain, or shortness of breath, well, all of these are possible side effects of one of the popular prostate drugs your doctor has been prescribing to you. So, are you treating your prostate right now, or poisoning your body? Besides, according to the researchers from the Department of Urology, University of Naples, there's another very common and shameful side effect of using such drugs, something called gynecomastia. This is a condition of enlargement of the breast tissue in men, when the breasts become larger and may even grow unevenly. It's no surprise then that almost all men on prostate treatment sooner or later stop being intimate with their wives, as the embarrassment is truly unbearable. And there's another huge downside when it comes to taking these. They all reduce your testosterone levels. The need to have sex will disappear, and by this point, your sex life is over. The third problem is that assuming you're willing to suffer and go through all the side effects described above, it'll still take at the very least around 6 to 12 months to reduce the size of your prostate by only about 25% at best. And I'm not even talking about the huge amount of money you'll have to fork over for this. According to a study performed by the experts at the Department of Urology, University of California, Los Angeles, men with prostate problems spend roughly $5,729 a year in treatment, with that cost increasing with roughly $1,500 on a yearly basis. So, what if these medications don't work? Say you've been on these medications for a couple of years and you're still having problems, or you're up all night, or what if you just don't want to be on medications for the rest of your life and avoid unnecessarily spending thousands of dollars? Well, 99% of the doctors will recommend surgical management. And of course, they'll do that. After keeping you hooked on them for years, it's time to move on to the next level: surgery. But did you know this? A new study from the University of Iowa compared the cost of prostate surgery at 100 hospitals throughout the United States. The results will make your blood boil. The quote for the procedure the researchers found varied from $10,100 to $135,000, with the average price being nearly $30,000. That's more than double the Medicare reimbursement. And maybe you'll be tempted to do that, even if it costs you an arm and a leg. But is this really the right choice for you? Because you see, once you take this road, you can never go back. Let me explain. Surgical management for prostate problems. All right, so you may know that the gold standard is TURP, which means transurethral resection of the prostate. What this basically means is that a hot electric knife will cut slices of the enlarged prostate tissue. Imagine a meat slicer, like the ones they use when you go out and eat a shawarma. But this particular meat slicer has a very, very nasty side effect. This is called retrograde ejaculation, which is when you have sexual intercourse and you ejaculate, no fluid will come out. In my opinion, not as a researcher, but as a man, just like you, no woman would like to be with somebody suffering from that. You should know that retrograde ejaculation is a side effect of the TURP procedure about 100% of the time. Other surgery options would be open prostatectomy, which is the complete removal of the prostate stents, laser therapy, or balloon dilation, which is exactly what you'd think it would be: the insertion of a balloon inside you to help you pee. Totally unacceptable. As you can imagine, all these procedures are quite dangerous and very invasive, but nothing really compares with a very expensive, more recent procedure which involves injecting a hot airstream into your urethra to burn the excess prostate tissue. Of course, this will get the urethra red hot and swollen, so you'll need a catheter for at least a week or so. Just try to imagine that. But let's hear it from someone who actually had the guts to go through this. How did this work out for him?
Doesn't work, period. This treatment only removes about 15 to 25% of the prostate at best. The prostate will continue to grow, and you'll find yourself back at square one. Plus, I was told, it's a procedure that only lasts 4 minutes and feels like the same heat as being on the beach on a hot day. How bad can it be, I asked myself. Okay, they had me straddle something like a dental chair and inserted a tube through my penis and onto my prostate. Like being on the beach? More like spending 4 minutes in the fires of hell.
So, my advice to you would be to ask your doctor this very important question. If I do any of this, will my prostate continue to grow? And how much of the prostate will be removed with this treatment? If your doctor will be truthful with you, the answer will shock you. So what can you do? Well, the obvious solution and the most important and urgent thing that you should take care of right now is to actually stop the growth of the prostate tissue. Once you achieve this, all your problems will be a thing of the past. And that's a scientific fact, not just my professional opinion. And the good news is that this can all be avoided. You just need to pull the right levers and completely stop your prostate from growing. It's that simple. And in the next 5 minutes, I will share with you what exactly you need to do starting today without any need for medication, surgeries, or other dangerous and expensive procedures that may cause more harm than good. But first of all, you may be wondering what causes the prostate tissue to grow. Well, I'm glad you asked, as the culprit is going to definitely stun you. Now, I'm sure when you go to your doctor for a regular checkup and you discuss any type of pee problem, he only looks at your prostate or bladder. That's entirely wrong, and here's why. After talking to countless men just like you for the last 5 years or more, I discovered what, in my opinion, is the ultimate cause of prostate enlargement and a primary hidden cause to nighttime nocturia, which is science speak for frequent nighttime bathroom visits. And it doesn't start with your prostate or bladder, but instead, it is centered on one very important hormone in your body. And the hormone that's involved in 80% of your enlarged prostate problem is not testosterone, it's not DHT, and it's not estrogen. In fact, the most important hormone which is causing your prostate problems is insulin, as proven by the top prostate researchers from the Department of Urology, University of California, San Francisco, and confirmed by multiple independent studies done by experts from the Department of Epidemiology and Biostatistics at the George Washington University and by scientists working at the Division of Urology, Queen Elizabeth Hospital, Hong Kong, China. The science is undeniable and the proof is 100% true. But let me quickly explain. Your prostate is a gland and it responds to growth signals from hormones. But what very few men know is that insulin is one of the most important growth hormones in our body. Insulin, when present in high amounts in your blood, can actually bind to a receptor for IGF-1, which stands for insulin growth factor 1. In short, IGF-1 plays a major role in promoting the normal growth of your bones and tissues, including multiplying prostate tissue cells. And what researchers have proven is that men with higher levels of insulin have larger prostates, a slow flow of urine, cannot empty out completely, and make frequent trips to the toilet both during the day and night. On the other hand, men with lower amounts of insulin tend to have a lower rate of prostate problems and are perfectly fine well up into their 80s or even their 90s. So, if you find yourself trapped in the never-ending cycle of running to and from the bathroom all night, only to squeeze out just a few drops, and never feeling relaxed and at ease after you go, then I bet that you may have a very high level of insulin. Plus, the older you get, the higher your hormone levels are. And a high level means not just a weak bladder, but also an ever-growing prostate. But how can you tell if you have a high level of insulin in your body? High insulin levels may not have any noticeable symptoms. However, if you suffer from unusual weight gain, inexplicable sugar cravings, frequent hunger, brain fog, lack of focus, constant fatigue, and tiredness, and especially if you have weight gain problems and are pre-diabetic or suffer from type 2 diabetes, well, these are some definitive symptoms of high insulin levels in your blood. Moreover, as proven in this very important study coming from the NYU Department of Urology and published in the National Library of Medicine, there are numerous foods which cause the increase of insulin levels in your blood and thus either enlarge the prostate and increase the risk of deadly prostate problems. Some of them include high-fat meat, such as beef, lamb, or fatty cuts of pork; full-fat dairy, such as whole milk, butter, cheese, or sour cream; processed foods, such as chips or convenience meals; sweets, such as candy, baked goods, or desserts; and foods containing high levels of starchy carbs, salt, or trans fats, such as corn, potatoes, and fried foods. But can our body prevent prostate growth in the first place? Well, that is a very good question. And in fact, yes, our bodies can do that